Right, welcome to Strength Month. I'm chatting with Dr. Tanya McEachern. Tanya, tell us what you do.
So I am a naturopathic doctor in Ontario, Canada, and I've got a practice of 700-800 patients, and I would say about half of them are women in midlife. So I treat a ton of perimenopause.
Awesome. So this month we're talking about strength. I kind of physical strength and mental strength, both of which can take a bit of a kicking.
Yes. Oh my gosh, absolutely. Yeah, your resiliency gets tested for sure.
Yeah. So should we start with mental strength? So resilience. Should we start there and go on to physical strength?
Yeah, that sounds okay.
Okay. So I think a lot of us, as we're going through perimenopause, we feel like we've run out of resilience. We've run out of cope, don't we?
Yeah. Yeah. Yeah, I'm always thinking of sort of like the physiology of that, right? So it's like, what are one of the reasons that, you take such a kicking or you feel it so much, right? And I do a lot of hormone testing and things, looking at the body that way. And a lot of times it's cortisol is completely depleted. It people will elevate for many, many years and then they can no longer maintain that and then they crash and then you sort of lose your buffer um, between you and your stress.
Yeah, I'm nodding because that's very familiar. So if someone's nodding as much as I am, um, what can we do to rebuild that resilience? I mean, it's not an overnight fix, is it?
No, cortisol it tends to be a hormone that it's more slower moving. So it's one of the slower ones to heal up. If you're talking about getting your body producing, the way that it should be, it can take some time for sure, but you can start feeling better immediately.
Yeah. So
Yeah.
what little hints and tips can people who just feel like they've got no more resilience left, what are the little things that they can do right now to just start putting them onto the path of supporting the cortisol?
Yeah. Certainly anything that you can do to support your sleep. So I hope you all were paying attention last month. Um, because that's something that's going to help normalize your cortisol levels and no matter where you're at, right? Like if they're high, sleeping better helps bring them down. If they're low, sleeping better helps bring them up. It's really hard to tell what cortisol levels are doing without testing because sometimes symptoms can be similar for high versus low. Treatment is going to be really different for high versus low. Like, for example, on the sleep front, if you have very low cortisol, it's recommended that you should sleep in the mornings, like as long as you can, even on the weekends, like non-work days. Don't force yourself to get out of bed early, like stay in bed and sleep for low cortisol. That's just one little example. Even the types of exercise that you would do, like if you have super low cortisol, you want to stay away from, the high intensity types of exercise, which of course so many women in midlife are, getting up and like, killing themselves with the cardio. But if you have low cortisol, that's actually not recommended. Um, in terms of what you can do if you don't know your cortisol levels, you could talk to somebody about adrenal support
Okay.
because there are certain herbs that will help. Whether you have high cortisol, it'll help bring it down. Same herb, you give it to a different person. If they have low cortisol, it'll help bring it up. So these are called tonics in herbal medicine. So it's like
So
you give it to the
clever.
person.
The body's so clever.
Exactly. Yes. Yes. So certain adrenal support herbs have this tonic action.
Amazing.
And so that's something that typically helps people with their mental stamina and fortitude. You can clear brain fog if you start supporting the adrenals. You'll have better blood sugar regulation, which helps people with their mental fortitude, right? Like keeping your blood sugar as stable as possible all day is going to help with what's going on up here. Yeah.
They are. I never knew these tonics existed. That's amazing.
Yeah.
So moving on to physical strength.
Yeah.
Obviously, you've just touched on the fact that just killing yourself in high intensity cardio is not going to be helping. But obviously, we do want to keep strong. We want to protect our bones. We know that our muscle mass is going to be decreasing. So
Yes.
what exercise is going to be nourishing us, shall we say?
Yeah. It depends, it depends on where that person is at, right?
Of course.
But if I take, the typical woman that I see, just sharing my experience of who walks through my door, um, it's usually a woman who, like, if she has to choose between cardio and strength training, she does the cardio. And I usually advise women in midlife to start doing the opposite. If you have to choose only one for your physical strength, do the strength training, because the list of benefits that gives you typically far outweighs the cardio benefits that you get.
Yeah, and I think whenever we talk about strength training, it's worth always just putting a little caveat to go, that doesn't mean that you have to go and hang out in the gym with the guys who are like, it can be
No,
body strength, like body weight,
your own
squats,
body
and
weight.
all that sort of stuff. I always
Yeah,
feel that I need to just sort of clarify that, because I think some people think,
100%.
oh, they're talking about strength training. I can't do that because I'm not going to go and stand in front of a mirror. But
It's true.
actually, just by virtue of using your body, you are strength training.
Yes. So I even have, like, I usually will give people a little at home starter strength training routine, because it doesn't have to be complicated. You don't have to leave your house, and it doesn't have to take you more time than you're already putting into exercise. You're just, reorganizing your time resources. Um, and you just use your own body weight. That's one of the best ways to start, because you're going to avoid a lot of injury that way. Um, so it's exercises like push-ups, sit-ups, like we don't have to overthink it. Squats, lunges, you put on your favorite TV show or a podcast, or you listen to music and you just, move your body while you're, having fun, trying to have some fun with it.
Yeah, no, awesome. And I think once we've got those two things, once we've got some mental strength back, we can then focus on working on the physical strength, and actually we can start becoming strong again, can't we?
That's right. These things like snowball into each other and help each other if you can just get started somewhere.
Yeah, I love it.
Yeah,
Thank you so much, Tanya.
my pleasure.